There are no 2 days in speech pathology that are the same. I think one of the joys of speech pathology is that we work across the lifespan. So we have the opportunity to work with babies right from the moment they're born through to the very elderly and palliating patients. And we work through such a broad range of areas. We work in communication, we work in speech, we work in language, we work in swallowing and helping people with their eating and drinking. There are so many good things about working in speech pathology particularly. One of my greatest joys is when you get to work with someone and you get to help them communicate what they really need or what they really want, or you can support them to advocate for their own needs in the healthcare systems, or you can support them to advocate for their learning needs to be understood and supported within the educational systems as well.
I would encourage people to study speech pathology just because it has so much scope. Whether you're interested in neurology and the brain and how stroke or car accidents may impact certain people, that's really interesting. Also working with young families, people with disability. It's just so broad, and I think that you're not in one particular job for life. It's very flexible.
Physio has a lot to offer from patient interactions, management opportunities, and really that it's a really well-respected profession too. I think it's wonderful to provide healthcare to the area in which you've embedded yourself and your family. So it's a lot about community for me and making sure that we have opportunities regionally like we would find with our metro counterparts as well. So it's lovely to be able to contribute to that from that management perspective as well.
I would see us as detectives in today's scope, where we are actually trying to work out why things actually happened rather than just putting a band-aid on them. The diversity of work as a physiotherapist is extremely great in the country areas. I think Charles Sturt Uni, being the university of the country area, is a great grounding for that, because you get to see so much more in the country versus the city.
We're very flexible amongst all different skill sets. So often if you can think of a particular injury or you can think of a particular type of patient, there will be a specialisation for that. Whether that be paediatrics, whether it be women's health, whether it be sports and exercise, there's really something for everyone in physiotherapy.
I would encourage any students to study podiatry because it's a great profession. You know, it's a really good blend and mix of biomechanics and sports injuries and those types of things that you might see in a physio, or a lot of medical things as well. You know, we deal with a lot of medical conditions. Diabetes is a pretty common one. And lots of other pathologies and medications and pharmacology and all those types of things that have the medical side of stuff as well. So it's a really good, nice mix and blend of that. And there's a massive demand for it. Lots of jobs out there. You can work anywhere in Australia or the world, and you can earn good money doing it. So I think it's really rewarding that way. Yeah.
The best part of my job is just being able to help people and to help them get back to their day-to-day activities pain-free. You can work in the private sector, you can specialise in like sports or stick to just your general podiatry. You can also go into like the public health system, which is working with high-risk foot, or do community health, which is also sort of high-risk foot or general podiatry. I think it's got a lot of good sort of career opportunities. There's a lot of jobs out there. There's just sort of a real shortage for podiatrists, and the profession's becoming a lot more sort of well known, well heard about. And there's just such variety with what you see day to day.
I think occupational therapy is a brilliant profession because of the diversity. You can get a job anywhere in the world and use it for the rest of your life, and the point is that you can study it and work in one area and then swap to another area without any concerns, whether it's what you intend on studying when you come to uni or whether you start and you transfer into something else. Having that background is really important. OTs cover the lifespan, so you can work in anything from paediatrics all the way through to older person's care. It can be physical health, it can be mental health. There is just diversity across the whole spectrum of life. So if you get tired of working in one with the degree that you can get, you can work anywhere.
As an accredited exercise physiologist working in clinical practice, our days are so varied. but that keeps it really exciting. At one point, you might be working with a patient to rehabilitate an acute sporting injury, and then you might see another patient who's had a brain injury, or working with older people who are trying to prevent falls, patients with diabetes, cancer, heart disease. It's so varied, you don't know what's going to walk in through the door. There are so many opportunities for career advancement as an exercise physiologist. There's opportunities to extend your knowledge. We are always learning, but particularly to specialise in different areas. So there is additional training that you can go and complete to work in specific areas with specific patients. I would encourage anyone who enjoys helping people to study exercise physiology. It's a very niche area, it's a growing area, but we can make such an impact on someone's life. Exercise is medicine, and the physiology behind it is really, really exciting, and to be able to share that with patients is a really great opportunity.